I'm going to go through the 6 causes of strawberry skin. I'll give you the strategy, the action you should take, and also some products that you can use to help to minimize the appearance. Hi ladies, I'm Dr. Simi, and in today's video we're going to be talking about strawberry skin. Strawberry skin is a made-up term. It's not a medical condition. It's actually an umbrella term used for different skin concerns that can give that dotted appearance to the skin. And I don't know who coined that term strawberry skin because it's not a medical definition, but I can see where they're coming from because the skin does have that dotted appearance like the seeds on a strawberry. If you've got lighter skin tone, then those dots can appear pink or red, and in darker skin tones they can look dark brown or black. Strawberry skin is most common on the legs, and when it occurs on the legs then it's called strawberry legs. Just realised how that sounds, duh. It's important to know what the cause is because this is going to be key in choosing products and treatments to improve the appearance. Okay, so we'll start with KP. So KP is a dry skin condition which causes the hair follicles to become blocked by dead skin cells and the protein keratin, and this then forms a bump that's centered around the hair follicle. KP feels bumpy and it feels rough. If your problem is KP, then your strategy is to avoid hot showers which encourage dry skin, moisturize the skin so that you're softening the skin cells, and exfoliate so that then you can just remove those dead skin cells off the surface of the skin. Good options for this are the amlactin lotion and also the CeraVe rough and bumpy skin lotion or cream. I prefer using combination of alpha and beta hydroxy acids such as the Face Theory clarifying cleanser. It's because the alpha hydroxy acids are really good for removing the dead skin cells from the surface of the skin, and then the beta hydroxy acids can actually get inside the pores and also exfoliate in them as well. For moisturising, try to look for the ingredient urea, which is available in products such as Balneum Cream, because this is fantastic for moisturising and softening those skin cells. In the clinic, we might help this process along a little bit by using prescription strength retinoids, which is going to speed up that exfoliation process, and we might also use chemical peels as well. If you've got KP that's associated with those red dots, pink dots, dark marks, then we can actually use lasers to fade those marks and improve the appearance. Another cause of strawberry skin are clogged pores. When you remove your hair, the pores are left open, and this means that they can become clogged with oil, bacteria, dead skin cells, and then you can see this as dark dots on the skin. That's what's giving you that strawberry skin appearance. If your problem is clogged pores, then your strategy is to exfoliate. I prefer chemical exfoliation compared to physical exfoliation because with chemical exfoliation we can use ingredients such as salicylic acid, and these are actually going to penetrate the pores because they're attracted to the oil in the pores, and then they're going to clear out the pore. Another benefit of salicylic acid is that it's an anti-inflammatory, so it can help to calm that redness that you can get surrounding the hair follicles. With physical exfoliation, you're really just removing and exfoliating the dead skin cells on the surface of the skin, but you're not able to get inside the pore in the same way. So good options for treating clogged pores that are causing strawberry skin are the Inky List Salicylic Acid Cleanser, the Ordinary Salicylic 2% Solution, and Paula's Choice BHA 2% Liquid Exfoliant. Another cause of strawberry skin is ingrown hair. So ingrown hair is hair that has become trapped under the skin instead of growing out of the hair follicle as normal. That trapped hair then starts to cause irritation around the hair follicle that then gives you that appearance of strawberry skin. If your problem is ingrown hair, then your strategy is to exfoliate to help free the hair and to calm this irritation. A good product for this is the Nip and Fab Glycolic Cleansing Pad and 1% hydrocortisone cream or ointment, which you can get over the counter, and you can just use it to spot treat those areas of redness, and it helps to calm the irritation and the inflammation there. In the clinic, we often use laser hair removal because this prevents a lot of the hair growing back and can therefore reduce your chances of getting ingrown hair. The hair root left behind in the follicle can also give the appearance of strawberry skin. After shaving, you might notice that the hair that's left behind in the follicle looks darker than the surrounding skin, and then it gives you that appearance of strawberry skin because you've got the dark dots. This is usually more noticeable maybe a couple of days after shaving because the hair has started to grow back. So if your problem is this retained hair, then your strategy is to remove the hair entirely. And the way that you do this is with waxing, epilation, electrolysis, or laser hair removal. These can all remove the entire hair so that the hair and the root is not left behind inside, causing that dark appearance. But with electrolysis, you have to treat each of those hair follicles individually. And if you imagine how many hair follicles you have, let's say on your legs, it's probably not that practical. But if I'm wrong and you've tried this, then please let us know how you got on and leave us a comment below. The next cause of strawberry skin is mechanical folliculitis. Now, folliculitis just means inflammation of the hair follicle that can be caused by either physical injury or infection. An example of physical injury to a hair follicle would be like what happens when you shave, and this would give you a mechanical folliculitis, which we know as razor burn. If you've ever made the mistake of shaving with a blunted razor or dry shaving because you're in a hurry, then you'll know what I'm talking about, because the rash and the itch can be intense. So if your problem is the razor burn, then your strategy is going to be try and cause as little trauma to the follicles as possible. You can do this by optimizing your shaving technique, which I describe in detail in this video. So waxing can also give a mechanical folliculitis because the action of uprooting that hair can be quite traumatic for the hair follicle, and then it causes that inflammation that's centered around the hair follicle. Again, you're going to get those red dots or dark marks. You can get PIH if you've got darker skin tone, and then it can take, weeks or months to fade. If you're waxing, it's kind of hard to minimize the trauma to the hair follicles, right? Because you can't pull them out less forcibly, but you can calm any irritation quickly. So if you see any redness, if you get that itching, tingling, you want to jump on it. So good options for this include aloe vera gel, which if you have pre-chilled it in the fridge, just feels like amazing when you put it on. It feels so cool and it's calming. And it helps to constrict the blood vessels that contribute towards inflammation. You can use over-the-counter 1% hydrocortisone, which will help calm the itching and the redness. Other options include using hair removal cream such as Veet. A bacterial folliculitis can also give the appearance of strawberry skin. A bacterial folliculitis is inflammation of the hair follicle, but that's due to a bacterial infection. Now, bacteria normally lives on the skin and doesn't cause us any problems, but we can develop tiny cuts and scrapes in the skin from waxing or from shaving, and this basically gives the bacteria easy access into the skin so that they can cause infection. And if this happens, you get this appearance of strawberry skin where you get red dots centered around the hair follicles. Now, if the infection starts to progress or gets worse, you can then get a buildup of pus, which looks like a whitehead on top of the red dots. If your problem is this bacterial folliculitis, then your strategy is to reduce the amount of bacteria that's on your skin. Now, if the infection's mild, you can actually do this at home by yourself by looking for cleansers that contain benzoyl peroxide or chlorhexidine. Good options for this are the Acnicide face wash, Hibi Scrub skin cleanser, Dermal 500 lotion, or Dermal wash. Actually, the Dermal 500 lotion is quite nice and convenient to use because you can use it to wash the skin, and then you can also reapply it as a moisturizer. If you notice that the infection is getting worse, if it's moderate or severe, or if you start getting that buildup of pus, then please see your doctor, because this could be a sign that you need antibiotics or some other form of prescription only medication. Thank you for watching this video. If you know someone that can benefit, then please do share it.